Welcome, dear viewers. We hope you are in good health. When you think of a heart attack, what comes to mind? For most of us, it's the dramatic scene we've seen in movies 100 times. Someone suddenly clutching their chest, gasping for air, a look of agony on their face before collapsing. It's loud, it's terrifying, and it's unmistakable. But what if I told you that this dramatic portrayal is only part of the story? What if I told you that almost half of all heart attacks happen with a whisper, not a roar? Studies from leading institutions, including Harvard Medical School, suggest that between 20 and 45% of all heart attacks are silent. They happen without the classic chest-crushing pain, without the drama, and often without the person even knowing. This is the silent heart attack, and it is the critically important topic of our discussion today. Your body often sends subtle signals, quiet warnings before a silent heart attack strikes. Do you want to know what they are? Are you aware of the 6 signs that are most commonly ignored? This video is more than just information. It could save your life or the life of someone you love. This video is for educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. All scientific sources used in this video are in the description. So, how is a silent heart attack different from a classic one? In terms of the damage they cause, they are identical. The difference lies entirely in the symptoms. Your heart is an incredible muscle, a biological powerhouse that works tirelessly every second of your life. It requires a constant supply of oxygen-rich blood to do its job of pumping that blood to every single part of your body. A heart attack, whether silent or classic, occurs when this vital blood flow is blocked. Imagine the arteries that feed your heart, the coronary arteries, as clean, open pipes. Over time, due to factors like high cholesterol, these pipes can begin to build up with fatty deposits called plaque. This process is known as atherosclerosis. A heart attack happens when one of these plaques suddenly ruptures or breaks open. Your body's emergency response system rushes to the scene, and blood cells called platelets scramble to form a clot to patch the injury. But inside a narrow artery, this clot can become the final obstruction, like a boulder blocking a tunnel. The blood flow is cut off. The section of the heart muscle fed by that artery is now starved of oxygen and nutrients. Within minutes, those heart cells begin to die. The severity of the heart attack depends on several things. Where is the blockage? Is it in a major artery, like the left main or the widowmaker artery? Is the blockage near the beginning of the artery, affecting a large area of the heart, or further down, affecting a smaller area? And most crucially, how quickly do you get help? Timely treatment is everything. And this brings us to the core danger of a silent heart attack. Because the person experiences no symptoms, or symptoms that are incredibly mild and vague, they don't realize what's happening. The thought of rushing to an emergency room never crosses their mind. And without that urgent, necessary treatment, the damage to the heart muscle can become extensive and permanent. Before we delve into the silent signs, let's quickly recap the classic symptoms of a heart attack, because shockingly, less than 5% of the global population can name them. First, there's discomfort in the center of the chest that lasts for more than a few minutes, or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Second, discomfort in other areas of the upper body, such as pain or discomfort in one or both arms, often the left, the back, neck, jaw, or stomach. Third, shortness of breath with or without chest discomfort. Fourth, breaking out in a cold sweat, often with a pale or ashen look to the skin. Fifth, nausea or vomiting. Sixth, feeling lightheaded or dizzy, sometimes to the point of fainting. And finally, a feeling of intense, unexplained anxiety or a sense of impending doom. These are the 7 classic textbook alarm bells. So, what about the silent heart attack? This is where it gets tricky and dangerous. Its symptoms are so subtle, they are often confused with other, far less serious health issues. A silent heart attack might not cause any chest pain, no numbness, no dramatic shortness of breath. To be perfectly clear, a silent heart attack can have no symptoms at all, very minimal symptoms, or symptoms that are highly unusual and not typically associated with the heart. This lack of recognition carries profound risks. A silent heart attack significantly increases your future risk of serious cardiovascular events. When you don't go to the hospital, the attack runs its course, leaving behind a scarred and weakened area of the heart muscle. This directly increases your risk of developing heart failure by an estimated 35%. Heart failure is a condition where your weakened heart can no longer pump blood efficiently. It also increases your risk of stroke and having another, potentially more severe, heart attack in the future. In fact, research shows that people who have had a silent heart attack and don't know it are 3 times more likely to die from coronary artery disease. The overall risk of sudden death within 10 years following the silent event skyrockets. So, let's talk about protecting ourselves. Who is most at risk? The risk factors for a silent heart attack are exactly the same as for a classic one. This includes atherosclerosis, which we discussed earlier. It includes diabetes, smoking, high blood pressure, and a sedentary lifestyle with little to no physical exercise. High cholesterol and triglycerides, excess body weight or obesity, and chronic inflammation also play a major role. Age is a factor, with risk increasing for men over 45 and women over 55, particularly after menopause. And finally, a family history of heart attacks or strokes puts you at a higher risk. Of all these factors, I need to place a special emphasis on diabetes. Why? Because diabetes wages a silent war on the body's nerves, a condition called diabetic neuropathy. This nerve damage can affect any part of your body, including the nerves that supply your heart. This is why people with diabetes are significantly more likely to experience a silent heart attack. The intense pain that should have served as a critical alarm system is muffled or even completely silenced. It's as if the heart's warning system has been disabled. That pain is your body's way of screaming for you to get to a hospital, and without it, the danger goes unnoticed. Now, let's move to the most important part of our discussion, the 6 silent signs of a heart attack that are too often ignored. Again, these symptoms may seem so mild that they are easily dismissed as a minor inconvenience or another less critical problem. Please listen closely. The first ignored sign is unexplained fatigue. This isn't just feeling a little tired after a long day. This is a profound, deep-seated exhaustion. You might feel physically ill, a vague sense of being unwell that you can't quite put your finger on. People often blame it on working too hard, not getting enough sleep, the stress of daily life, or even just the process of getting older. Many women, in particular, might dismiss it as a passing virus or feeling run down. But if you have any of the risk factors we just discussed, and you experience a sudden, heavy, and persistent fatigue that feels disproportionate to your daily activities, do not just push through it. It could be your heart struggling. Don't procrastinate. An electrocardiogram or EKG and a blood test for cardiac enzymes in an emergency room can provide a clear answer. The second silent sign is mild discomfort in the chest area. I mentioned that a classic heart attack has intense pain. In contrast, many silent heart attacks present with only a mild, fleeting discomfort in the center of the chest. It doesn't feel like a crushing weight, but more like a dull ache, pressure, or a strange feeling of fullness. The immediate thought for many is, oh, it's just gas, or I'm having some heartburn from lunch, or maybe it's just indigestion. But if you experience this sensation and something in the back of your mind feels off, trust that instinct. It's a signal that should be evaluated by a doctor. The third sign is sweating for no reason. If you suddenly find yourself breaking out in a cold, clammy sweat, but you're not feeling particularly hot and you haven't been exercising, that is a significant red flag. This isn't the kind of sweating you get from being in a warm room. It's a physiological stress response. Your body is reacting to the trauma your heart is undergoing. Especially if you are diabetic, this symptom alone should be enough to make you consider that it could be a silent heart attack and prompt a visit to the emergency room. The fourth silent sign is shortness of breath. Imagine you've just walked up a small flight of stairs, maybe 6 or 7 steps, but you suddenly feel as winded as if you had just run a marathon. This is a potential sign that your heart is struggling and cannot efficiently pump oxygenated blood to the rest of your body. In the context of a silent heart attack, this shortness of breath can occur with or without any chest discomfort at all. We call this dyspnea disproportionate to exertion. It's a very common but often overlooked warning sign. You might also feel dizzy or lightheaded, and in some cases, you could even lose consciousness for a moment. The fifth sign is nausea or a feeling of indigestion. A person might think they have a simple stomach bug, a touch of the flu, or that their dinner just didn't agree with them. But nausea, especially when it appears suddenly and is accompanied by other subtle symptoms like a cold sweat, unusual fatigue, or mild chest discomfort, can absolutely be a sign of a heart attack. The nerves in the stomach and heart are closely related, and the heart's distress can manifest as gastrointestinal symptoms. The sixth and final silent sign is discomfort in other parts of the body. Unlike the often intense radiating pain of a classic heart attack, this can be a much milder, more confusing sensation. You might feel a dull ache in your jaw, a nagging discomfort in your upper back or between your shoulder blades, a strange sensation in your neck, or a feeling of pressure in your stomach. Some people have described it as a feeling of a rope being slowly tightened around their back. These are not the places you typically associate with your heart, which is exactly why these symptoms are so easy to ignore. Do not dismiss them. I know what you might be thinking. It sounds difficult to recognize a silent heart attack because the symptoms are so vague. And you are absolutely right. That is precisely what makes them so incredibly dangerous. So how can you protect yourself? Is there a way? Of course there is. First, if you have already had a heart attack, silent or otherwise, or had a stent placed or undergone heart surgery, you are at a higher risk for another one. It is non-negotiable that you see your cardiologist regularly and take your prescribed medication. There is no point at which you can say, "Oh, I've improved my lifestyle, so I can stop my medicine." That is a dangerous misconception. If you have established heart disease, medications like statins, beta blockers, and aspirin are life-saving tools that reduce your risk, and no supplement like magnesium, coenzyme Q10, or vitamin K2 can replace them. But what if you have never had a heart attack and want to do everything in your power to prevent one? The good news is that it's estimated that half of all heart attacks can be prevented by changing a few key habits. For example, quitting smoking reduces your risk of a heart attack by a staggering 30%. Keep your blood pressure under control, aiming for a target of 120/80. If you have diabetes, it is crucial to keep your blood sugar well managed with a hemoglobin A1C level below 7%. Focus on eating well. This means reducing your cholesterol and triglycerides with a diet rich in fruits, vegetables, lean proteins, and whole grains, while minimizing processed foods, sugar, and saturated fats. Get active. Aim for at least 150 minutes of moderate intensity physical activity per week. That's just 30 minutes, 5 days a week. A brisk walk counts. Prioritize good sleep, aiming for 7 to 9 hours per night. If you are overweight or obese, work towards a healthier weight. And don't underestimate the power of human connection. We now know that loneliness and social isolation can increase the risk of a heart attack by nearly 30%. Build new relationships and nurture your friendships. Finally, don't forget the importance of regular heart checkups with your doctor. Based on your personal risk profile, your cardiologist may recommend more in-depth tests, such as a coronary CT angiogram, which can visualize your arteries and detect plaque buildup. This isn't for everyone, but for select cases, it can be a true lifesaver. I hope you found this video valuable and that you've learned something new and vital today. The key is awareness. By recognizing these subtle signs and understanding your personal risk, you empower yourself to act decisively. Remember to share this video. You never know whose life it might save. Thank you for watching. Please consider subscribing to the channel for more health insights. Until the next video, take care.